Founded the practice in 1997, and we have the medical dermatology side of things. And as I like to say, that's the side covered by insurance, and the cosmetic dermatology is the side that's not covered by insurance. We also have a little spa where we do facials and things like that, cellulite treatments and things. We have a Center for Skin Research where we do clinical trials for pharmaceutical companies and cosmeceutical companies, laser companies, and so we're always looking for volunteers if you ever want to participate in a clinical trial. We're often testing new anti-wrinkle creams or acne medicines or psoriasis medicines, things like that. So we have our research folks over here if you want to learn more about that. All right, we of course now have two locations. This one out in the Katy Ranch, which we opened in 2013, and then the one in the Galleria area on St. James, which we've had, was our original location. So two places. This is our team of physicians in kind of the years they joined. Dr. Katz, April Harrison is my physician assistant, Dr. Peterson, Dr. Ogenmachen, who just spoke a few minutes ago, myself, Dr. Doubleday, Maria Antesoda is a registered nurse who does our stuff out in Katy with the lasers and fillers. Marcella is our nurse practitioner, and then Dr. Eubanks. And then we have three lovely estheticians. That Heather is the one out in Katy, and then Maria and Patricia are in the Galleria location. Our aesthetic consultants are our team that really kind of help you navigate through this complicated world of cosmetic dermatology. There's so much going on in our field. It's just a booming field with new lasers, new fillers, new devices coming out all the time. It gets confusing, people get overwhelmed, and these are the ladies that can really kind of help you understand, you know, what treatments do what and how to book something, how to schedule it, and so they're all very helpful, and they're also experts on skincare, getting you on a good home skincare regimen, which we totally believe in. So the neck topic, I always love the title of this book. Nora Ephron, I don't know if y'all know who she is, but she is the one who wrote the movie screenplay When Harry Met Sally, and she's written a number of other books. She's passed away now, but she's a very clever, funny writer, and I love the title of the book. I feel bad about my neck and other thoughts on being a woman. It's got some funny lines in there, but this is a quote from the book. Our faces are lies, and our necks are the truth. You have to cut open a redwood to see how old it is, but you wouldn't have to if it had a neck. Because a lot of times, you know, a lot of us were good about putting sunscreen and makeup and taking care of our faces, but a lot of us were not so good about protecting our neck from the sun. And because the neck skin is so thin and delicate skin, it tends to age faster, actually, than other areas. Just like our eyelids age faster, our hands age faster. So the necks often are difficult areas. And they're even a little bit more difficult to treat because our faces have more pores, which are the follicles. And actually having all those pores helps with healing when you do procedures like lasers. But our necks, because we don't have as much hair on our neck and don't have as many pores, the necks are actually more delicate to do lasers on and more difficult. So necks can be a challenge to rejuvenate. This is just a slide, which I think is a great slide, showing a lovely mother-daughter pair, Susan Sarandon and her daughter. And just look at the young neck, beautiful, smooth, lovely. And then, I mean, Susan Sarandon's neck's not bad, but you can see it's got some sagging, it's got a little bit of lines there, and around her eyes, a little bit of lines. So it just illustrates, and pull out pictures of yourself when you were 16. Of course, look at yourself when you were young, and we were all like that in the beginning, and then just over time, of course, time takes its toll, and sun, of course. Okay, so how can we rejuvenate the neck? And these are kind of the things that we're going to talk about. Everybody should be on good home skincare. Everybody should be putting sunscreen on every day because a lot of our sun damage is just what we call incidental exposure. Just when you get out of your car at the grocery store and walk across that parking lot, even if it's a few minutes, day after day after day, it's adding up. That sun damage is cumulative. So that's why every morning before you leave your house, put your sunscreen on and put it on your neck and chest. And of course, the other thing I like to add when I'm preaching sunscreen is that because you're wearing sunscreen, you're not producing vitamin D through your skin. So most of us that are wearing sunscreen are going to need a vitamin D supplement orally Otherwise, you're going to be low on vitamin D. And probably, I bet your doctors nowadays are good about checking you to make sure your vitamin D levels are up. There's a lot of topical stuff that can help the skin, and I'm going to show that in a minute. Things that have retinol, antioxidants, growth factors, peptides. There's science proving these help stimulate your skin cells to build collagen. So this is hard science. We know it benefits the skin. Now, the retinol, that's similar to retin A. That's vitamin A. We know vitamin A is beneficial for collagen building, but because the neck doesn't have many pores, i.e. it doesn't have many oil glands, many people find the retin A or retinol too irritating to use on their neck because it gets peely, red, irritated. So it's occasionally some people can tolerate in their neck, but that's why a lot of our neck anti-aging, we use things like antioxidants, growth factors, and peptides that are not irritating like retinoids. Our faces, because of our oil glands, are more able to tolerate the retinoids. All right, we're going to be talking about muscle relaxation with Botox and Dysport, fat reduction with the Kybella and Cool Mini. After this, later on in the morning, Dr. Peterson will be discussing lasers to help with the neck. And so that is what is going to help if you have a lot of brown spots or a lot of surface texture change using fractionated lasers like Fractional or the IPL Intense Pulse Light. But because she's discussing that, I'm going to not talk about that. But we will talk about skin tightening, and our two favorite devices for skin tightening are Thermage or Ultherapy. Okay, so this company was brilliant. When they named their product Nectifirm, it flew off the shelves. But it really does work. And so when we started carrying this line of skincare, this was the first product we brought on, and we found it really was helpful. So here's some of the before and after pictures. And again, this has a cocktail of peptides, antioxidants. It doesn't have the retinoids, and so it doesn't irritate. It's really rarely, if ever, do I see anybody who gets irritated from the Nectifirm. So this is something good you could put on your skin morning and night. And again, we have lots of photography like this that shows, yes, there's definitely an improvement. Obviously, she still has some lines and she still has some texture changes, but her skin is definitely looking better. Here's another person who had a lot of wrinkles, a lot of texture change, and after 8 weeks. And so what we like to do with our patients is when you come in and get on a skincare regimen with us, we like to take a baseline photo and then bring you back in a couple months to get another photo, because sometimes the changes are so gradual, it's hard to remember what did my neck look like 2 months ago. But if you have a photograph and you can see the difference, then you become a believer, and then you become committed to sticking with your skincare regimen. So here's another one. You can see some of the lines are better, some of the sagging. She still has some sagging, but it's definitely looking better there. Okay, another one of our favorite lines of skincare is Skin Medica. This company is now owned by Allergan, which is the company that makes Botox and Juvederm. And we actually got to go out to their headquarters in California a couple months ago and tour their research labs. And Skin Medica has, because they have Allergan money now backing them, they have an amazing research lab. They have a team of PhD scientists. They do research all the time about what are the best ingredients to put in their products. So they're always coming out with these new products. So they recently did this study combining the TNS recovery complex, which has growth factors. The growth factors trigger your fibroblasts in your skin to make new collagen. And then this new sunscreen they came out with called Total Defense and Repair. It's got great sun protection, but in addition it has a cocktail of antioxidants, which again, vitamin C and other antioxidants that are shown to help with collagen production. So they did a clinical trial using this combination, and they did it at their clinic there in California. They did standardized photography. They asked, patients questions. They had dermatologists looking at them. They looked at the patients at baseline, after 4 weeks, after 8 weeks, after 12 weeks, using this combination. So they had 16 women between the ages of 48 and 65. So in the morning, they would put on the TNS recovery complex with the growth factors in it. Then they put their sunscreen on top of that with the antioxidants in it. And then at night, they did the recovery complex. And then they were free to use a moisturizer on top of that if they wanted to for just general moisturizing. So here's a subject showing after 4 weeks. Those horizontal lines are still there, but they're not quite as deep. And just even the toning and the firming looks a little better. Here's a patient who had a really wrinkled, saggy neck. after 8 weeks, it's better. And this is something I want to point out how she's got what we call vertical bands. So these are muscle bands. That's a muscle band, that's a muscle band. We call those platysma. The muscle in the neck is called the platysma. And as we age, as the skin on top of the muscle gets thinner just from aging, the muscle bands start to show through, and you'll get what a patient earlier called spaghetti neck, where you see the vertical bands. So that is something that later we'll talk about using Botox to treat. Here's another patient after using it for 12 weeks, and you can see how the kind of the loose skin, she still has wrinkles and texture changes, but it's definitely looking better. Here is a patient from the side showing improvement in her neck. So definitely, you know, skincare is a must. And whether you use the Nectifirm or whether you use the Skin Medica products, every day put something like that on your neck to help with anti-aging, in addition, of course, to the sunscreen. All right, so we mentioned the muscle bands, the platysmal bands, that we can treat with Botox, which is, these are both botulinum toxin. They work by relaxing the muscle, and that relaxes those vertical bands. The other company makes the one called Dysport. They're both very good. I think they're equally effective, so either one I think is very effective for this. So here's showing a patient contracting. So if you kind of grimace and contract, I can't do it because I actually put Botox in my neck recently. You try to grimace and look at your neighbors, and you can see the vertical bands kind of popping out. And then after, here she is trying to grimace, but those vertical bands are not popping out as much. Or here's another patient doing the sort of the grimacing before, and then after, those bands are smaller. Submental, the mentum is your chin, and submental means under the chin. And so they actually study this, and they look at, okay, what is the ideal angle? So this is the ideal angle, around 110 degrees. If you do a straight line under your chin, and then you go to the neck, you want that ideal angle to be 110 in a beautiful neck, supposedly. So that's what we're shooting for, ideally. So this is a Kybella patient. She's in her 20s, beautiful young woman, and she's not overweight at all. So this isn't from being overweight necessarily, although if you are overweight, it can make it worse. But she just had that little fullness under her chin here. And then after one treatment with Kybella, she has more approaching the ideal necklines because it took away just that little fat compartment there. So that's 1 month after one Kybella. Now because she's young and she just had a little bit, one session was enough. Some people, if they have more fat there, sometimes they need to do 2 or 3 or even 4 sessions of Kybella. But this would be, you know, perfect for somebody that just has a little bit, is to do that Kybella. These pictures were from the Kybella clinical trial that got it FDA approved, and we actually participated in one of the clinical trials in our research center. And showing from the side view as well as the front view, this is a man who had the treatment, and you can see in the after he's got a better angle there on his neck, and then from the front view he's kind of lost that double chin look from the front view. Now here's a woman age 55, and you can see that, you know, she's got that little blunting of her angle where it's kind of bulging out there, and then now in the after she's more approaching that ideal angle that we're shooting for in the neck. And even though she has some skin laxity to start with, people were concerned at first, well, if we take away the fat, is the skin just going to hang and look worse? But it didn't. In the clinical trial, even though you took away the fat, the skin seemed to just retract. And that's what we see when we freeze the fat on the body too. Most of the time, the skin just kind of retracts a little bit. So you can see now after, she does still have a little bit of muscle banding here. So if that bothered her, you could go in and Botox those muscle bands and get those to smooth down too. Okay, here's another woman, and she had, again, blunting of that angle, and now afterwards, she's more approaching, you know, what we're shooting for with the ideal angle. And again, even though she's got some skin laxity, she didn't get worse with the skin laxity. Now, this is a good example of where you treat the fat first, get rid of that little pocket of fat, then you can go in and do a skin tightening procedure like thermage or L-therapy to tighten the skin on the neck and try to get, you know, the skin tightened up in addition to the fat reduction. So each piece of the puzzle, each treatment is doing a different piece of the puzzle. So the Kybella or the Cool Mini for the fat, and then for the skin, the Thermage or the Ultherapy, which we're going to talk about in a minute. Okay, now if somebody has a bigger amount of fat, it tends to be more effective, cost-effective, and time-effective to use the freezing method, the Cool Mini, which is the cool sculpting. So if somebody has a little fat, we would tend to go with the Kybella injections, but if somebody has a lot of fat, we would tend to lean toward the Cool Mini. So she had quite a big fat compartment there, and most people with the Cool Mini need to do 2 sessions. So this is showing her after 2 sessions, spaced about 6 weeks apart, 4 to 6 weeks apart, but usually 6 weeks apart for the Cool Mini. And you can see she's had a lot of improvement. Now again, she probably still had some skin laxity, so she could benefit from some skin tightening now, either Ultherapy or Thermage to try to get even more tightening under there. Now let me just back up a minute. The other option, oh, this is her from the front view. The other option, just because I'm a dermatologist, I don't do plastic surgery, but another option for people that want to improve their neck is liposuction, where they can go in and do liposuction to take out the fat, and a neck lift, surgical neck lift. So that's another option, just to throw that out there. I'm not a surgeon, so I don't do those things, but these are just sort of the less invasive options for people that don't want the surgical options. These are what we have. So you can see she had a pretty nice improvement after 2 sessions of the Cool Mini. Here's a man with a big area of fat under there, and after 2 sessions it's reduced. And you can see from the side, it's not perfect, but it's better. He's got less of a bulge there, and definitely better after 2 sessions. Okay, now for the skin tightening, I'm going to turn it over to Maria Antesoda. She's a registered nurse, and she works out at this Katy location, and she's going to talk to you about skin tightening.
Okay, so for people who are looking for non-surgical options for tightening the neck, and after using your products, you still feel like you need more tightening, Thermage and Ultherapy are our favorite options for that. We're going to start with Thermage first. It is using radiofrequency heat that travels below the surface of the skin to stimulate and help regenerate those collagen fibers, so that we're tightening, lifting, filling in those areas where you created some fine lines and wrinkles over time. This just shows you the collagen matrix and how it thickens over time. There'll be some before and after photos too that show what it looks like before Thermage, then 10 months after a Thermage. With both skin tightening procedures, it usually takes anywhere between 3 to 6 months before you start noticing those optimal results. And as Dr. Bruce stated earlier, we'll do a baseline photo first, because it's such a gradual process that you don't notice those small little changes. What most people notice at first will be just the improvement of the overall skin tone. The skin just looks so much better, more radiant. And then you might start noticing changes like, oh, that line doesn't look quite as deep anymore. Another patient who had Thermage. So it gives you, this patient did not have any type of fat reduction on the chin area. It's just able to tighten and lift the area. Another patient, she was actually a patient of ours. This is 6 months after her treatment. Another patient, before and after. You can see right here the jowls, which is where most people start to complain about when they're talking about their necks. They're also complaining about the jowly area. So it helps to, and we did treat her entire face. It was full face plus her neck. So moving on to Ultherapy, and people get a little confused when there's both Thermage and Ultherapy out there. We still position Ultherapy as being a deeper type of treatment because it is going into the skin much deeper. And this slide will show you here. So with Ultherapy, it's actually getting in as deep as what surgical facelifts get into. We're getting into those muscle fibers so that it's helping to lift and tighten from even deeper than where radiofrequency is. But you'll see in the before and afters, there's not too much of a difference between the before and afters with the between the thermage and the oil therapy. So this is the oil therapy. This is how deep, they typically will do a surgical facelift. Lasers are superficial, so lasers are different. We use lasers for brown spots, texture of the skin. The oil therapy and the radio frequency are what we're using to tighten the skin, but they don't work on anything with the brown or the red in the skin. And just gives you an example of where we're treating when we're doing the oil therapy face and neck treatment. There are a certain number of lines that we put into the face and neck. Now that being said, and going back to the other slide as far as the depth, the oil therapy we do tend to numb for, whereas the thermage we do not. The thermage, we just need patient feedback. We want to know that you're feeling heat, and as long as we're at that level, we don't need to numb. With oil therapy, it's a little different because we're getting in deeper, we're getting down to those muscle fibers. We do tend to give patients medication, and we do the topical numbing. The ideal candidate for oil therapy is somebody with mild to moderate skin laxity, but that doesn't mean that we can't treat patients with severe. It's just some patients who have more might want to consider doing surgery, doing another treatment soon after they've had their first. Sometimes having it done at 3 months versus waiting, another year, because most patients after doing either thermage or oil therapy really don't need to be back for another, 12 to 18 months, sometimes even longer, depending on how well you're taking care of your skin, the skincare regimen, etc. And you can see, this is a patient with mild laxity, and you can see how it just tightened up her jawline, and severe laxity. This is after a second treatment though. So she had 1 and she did have 2. And just various, before and afters from mild to severe. Right. And as you can see, all of these photos are done after 90 to 180 days because that's when optimal results are usually seen. You probably won't see anything within the first, first few weeks after thermage or oil therapy. So, any questions?